Welcome back to The Price of Business. Here we are, and we continue to do coverage here at the Free Market Medical Association in Oklahoma City. Great event, wonderful event about really the war of ideas when it comes to how we take care of ourselves when it comes to healthcare. This model that we've been dealing with for decades has really destroyed the relationship, or at least injured the relationship between the doctor and the patient. This organization is working, and these are some of the people on the front lines that are working to restore that relationship and to really make healthcare built on common sense and affordability. And so I'm excited to be a part of it, excited to be covering it for The Price of Business and USDailyReview.com. Dr. Goyal and I, we partner up to do this. And this pair right here is going to be a very interesting guest. In fact, we had about a 12-minute interview before the interview itself started now. They have lots to say, and I'm looking forward to hearing. Go ahead and get us started.
Yeah, I call what we are doing a shadow healthcare system, right? Mm-hmm. Whatever is going on that everybody sees and hears, that's there, but what we are doing is a shadow healthcare system, and I think eventually the momentum with the shadow healthcare system is going to be big enough that we're going to overtake what's happening. And so what we have, Kevin, is brothers, Sean and Patrick Kelly, out of Austin, yep. And Patrick is a surgeon, correct, craniofacial surgeon, mostly deals with congenital abnormalities, so works with a lot of kids. Has worked a lot in the Medicaid space, and there's a whole lot of controversy about Texas not accepting the Medicaid expansion. Mm-hmm. And Sean, you started the Texas Free Market Surgery Association. So welcome both of you, and I would like to start with you, Sean, first. Tell us more about Texas Free Market Surgery, please.
Okay, so Patrick and I started it together, but Patrick and I recognized that there was a huge problem for people that needed health care, but their PPO networks weren't functioning the way they should. Okay. So people needed procedures, and we're talking mostly here about healthy people, right? Mm-hmm. So people that need a hernia repair, or they have a bunion. People like that right now, the choices they make through their PPO network can have some extremely variable results. So for instance, you could get a bunion done in your PPO network at a hospital, and it may cost $25,000, facility surgeon anesthesia.
Wow.
But as Dr. Keith Smith at Surgery Center of Oklahoma has shown us, if you peel out a lot of the administrative complexity and a lot of the costs associated with the fee-for-service system, you can actually pay the providers, the facility anesthesia and surgeon, more, and the bill is a great deal less.
Wow. So, and it's just eliminating layers. I've already mentioned it in interviews before. Thomas Sowell's famous quote on why Obamacare wouldn't work is that all you're doing is adding a layer to the cost. When you add layers, the costs are going to go up. What you guys are doing is you're eliminating layers. And that's really the heart of this revolution. Mm-hmm. Not only is it a financial advantage, but it's a relationship advantage, restoring the relationship between the patient and the doctor that's largely been obliterated by the government approach and the insurance approach. Talk about how revolutionary that is, especially as a medical doctor, and you share notes with others who have gone a traditional route.
Yeah, so the current system is so complex, and I think our eyes were, we were in the middle of a hospital system trying to get change or affect change to both reduce the complexity and improve the outcomes. And there just wasn't a lot of inertia for either of those things, to either improve outcomes or reduce price. And so we started scratching our heads like, why is that? Like, no other business is like that. Mm-hmm. I had patients, I do very complicated surgery. I have patients coming to my office with the EOB saying, you didn't get paid anything, but everybody else got paid a whole lot. Mm-hmm. And then in the context of the fact that medical bills in the United States are the number one cost for bankruptcy in the United States, 75% of those people have medical insurance.
Wow.
So it just is not logical anymore.
There's something wrong.
There's something wrong. And so for us, it was about, like you said, kind of tearing the layers away. We spent a lot of time trying to understand the market. What we really began to understand is when a patient or a provider sees a medical bill on this side, on the inside, on the end of the very end of the chain, On the very beginning of the chain for the employer, that spend is tremendously higher. So there's a lot of people with their hands in the till that aren't necessarily adding value. And in order to prevent utilization in a PPO network, all of the system keeps adding more and more hurdles for the doctor. So the amount of work the doctor has to do to actually get something done keeps going up. Their pay keeps going down. So that's why we're seeing the disenchantment of physicians across the country, why physicians are retiring earlier, wanting to get out of medicine, because their work is getting
going
more
into fields that doesn't require dealing with insurance, like not dermatology per se, but forms of plastic surgery.
Yeah, plastic surgery, LASIK, other things like that.
Gotta wrap up this segment. Let's get your website real quick.
Okay, we're at texasfreemarketsurgery.com.
Yep.
We have currently we have specialties, ENT, general surgery, ortho, foot and ankle. We also have a lot of plastics. Patrick's actually put the very first cleft lip, cleft palate bundles in the country up on our website.
I sometimes need help with foot and mouth, so I might have to talk to you about that.
When we come back, though, I want to talk to Patrick and Sean more about the plans to expand in Texas.
Absolutely. And Dr. Goyal, by the way, you can learn more about him at ourwayhealth.com, ourwayhealth.com. Do want to remind you, this segment and many more will be found over at usdailyreview.com, the national news website, and the show continues 24/7 at priceofbusiness.com. All right, welcome back to The Price of Business. I'm your host, Kevin Price, and we're here in Oklahoma City continuing our coverage of the Free Market Medical Association. It's a great event. I'm delighted to be here with Dr. Geetender Goyal, Dr. Goyal with Our Way Health. That's ourwayhealth.com. We're meeting some really interesting individuals, people who are on the front lines. We're going to continue our interview with brothers, Sean and Patrick, and their work that they're doing, particularly in the pediatric space. But I got a feeling they'd like to go into other areas as well because the demand is so huge. Before we get started with Dr. Goyal's first question in this next segment, again, Sean, just give us just a panoramic overview of what you do. And that's the Kelly brothers.
Yeah, exactly. So what we do is we bundle procedures. So just like Dr. Keith Smith at Surgery Center of Oklahoma, we actually approached him first to see if he would franchise. He said, no, thank you. But he taught us a lot of stuff. Yeah. So what we do is we bundle the facility, the surgeon, anesthesia, and anything else, including rehab, into one bundle. We offer one price. We don't take any fee-for-service contracts, but we do direct contract with employers. We mostly direct contract with TPAs, but we also accept individuals who come to us. And just to correct you earlier, the pediatric, that's what Patrick does, and that's what in his hospital work, and that's what I did for a great number of years building stuff. Right now, we're focused on pediatric and adult, mostly adult.
Cool.
So what we have right now is we have a small facility where we can do a scope of work. And then beyond that, we have plans to grow much greater. We're in discussions right now with a hospital, a local surgical hospital, to add spine, cardiac, joint replacement. So we are addressing what we think are kind of the big market needs. At the same time, this is you said a shadow market. You're absolutely right. Getting to the people who can bring patients to save money is a Byzantine process, as I'm sure you found out.
Absolutely.
And bundling, just for our listeners, why bundling is important, just to give a quick analogy, and I heard Jake Hampton use it before, that look, if you go into a car dealership and you want to buy a car, right, you don't buy tires separately or seats separately. You buy the whole thing at one price, and that's what we're kind of bringing back to medicine. So you're not breaking down the parts.
Not an a la carte approach.
Well, I think the other very important element to this, which I think we've hit on a little bit, but I want to emphasize, is that the price is publicized.
Yeah.
Right.
So our prices are transparent. They're on the internet. There's no haggling up and down or anything like that. Our price is our price. We feel like we've driven the cost, all the unnecessary cost of delivery out. The interesting thing that I think you'll find interesting is in our system, in our bundles, our providers make about 2 times, sometimes up to 4 times what a Blue Cross network would pay them for the same amount, for the same work. But our total price is about 30 to 40% cheaper than a surgery center and 80% cheaper than a hospital.
So we call our approach shadow. We call their approach shady.
That's a good one.
That's good.
I know you wanted to focus on something in particular. Let's get to that real quick.
You guys are starting in Austin. We are in Houston. We would love to have you expand to Houston. First of all, educating the Houston community, but then also have more facilities join in the movement. Plans on that?
Yeah. So I'll tell you, as a bootstrap, this is the Kelly brothers here, and the pockets that we have are funding this. So as a bootstrap startup, we didn't want to take money because then somebody's going to shift us on to fee-for-service when things go slow, and they have been slow, okay? We've gotten great reception from the provider community. We've gotten great reception from a lot of people, but when you get down to it, it is going to be a slow go. So what we've determined is that with the amount of capital and things that we have, it's better for us to focus on building the model in Austin, and that'll be another 3 to 9 to 12 months, depending on how fast things ramp up. But we've always built it with the intention of scaling and repeating. So scaling our back office to the degree we can, and then repeating by going to San Antonio, to Houston. We're both 5th generation Houstonians. So our parents still live there. Our sister's a pediatrician in Houston. We would love to be in Houston. Dallas is another market.
Absolutely. Got to wrap up the segment. Patrick, your website?
TexasFreeMarketSurgery.com.
Dr. Jitendra Goyal can be found at Our Way Health. And of course, this show continues 24/7 at priceofbusiness.com.
Thank you for being here, guys.
You're welcome.
Thank you.